Hey guys, welcome back to my channel. Thanks so much for joining. I'm Ginille, a cosmetic nurse practitioner. I've been injecting Botox, fillers, doing all the fun lasers, skin treatments since 2013. I own my own practices, Ginille Beauty Aesthetics in Los Angeles. Now, I know this whole world of medical aesthetics can get a little overwhelming. You might have a lot of questions. So I'm here today to help answer the top most asked questions that I get. Let's check them out.
So since you've been in this field since 2013, what's your favorite treatment to do or favorite treatment to get done?
Okay, I really love all of it. I will say cosmetic injectables like Botox fillers, all natural fillers, what I specialize in, and that is where I can just really help the patient when I do their faces and we look at their full face and we're not just spot treating. I hear all the time, they're like, I just feel like I look like myself, or the outside matches the inside. They just feel more confident. And so that's what I like, the cosmetic injectables. That is not to say I don't love doing all the skin treatments, because everything has its place in this space. And then for me, what is my favorite thing to do? I'm breastfeeding right now, so I can't do a lot of things, but I love doing the skin treatments. I feel like once the skin is glowing, you know, the lines and the wrinkles don't matter as much, but I have done everything on my face.
So you talked about Botox. What exactly is Botox?
Okay, so Botox, this is a medication that is going to relax your muscles from contracting so forcefully or flexing so hard. So cosmetically, we'll use this most commonly, like people will do it for frown lines, you know, the horizontal forehead lines around the eyes. However, we use this other places on the face, the neck. We use this therapeutically for treating migraines, TMJ symptoms like headaches, clenching, teeth grinding, jaw pain. And then in medicine, they're using Botox in a whole host of other ways. So cosmetically, how we're using it is to minimize, you know, frown lines, smile lines from getting etched in on the skin.
You talked about filler. Mm-hmm. What's the difference between Botox and filler then?
Okay, so remember, think of your Botox as relaxing the muscle from flexing so hard. Your filler, you're gonna want to think of as something to volumize, plump, lift, hydrate. I say lift, I don't want to mean, it's not like lift like a facelift, but it's going to help create highlight on the face so that it does look lifted without actually pulling the skin back. So most of the patients are doing both of these, a combination of these in different areas of their face. So very commonly for a filler, we're doing under eyes when somebody feels sunken or hollow, if they feel like their cheeks are not as lifted as they were used to, when they're noticing smile lines getting deeper or the corners of the mouth start drooping down, that's where we'll use filler to help minimize that, you know, the sunkenness.
How long does Botox last and how long does filler last?
Okay, so your Botox, your wrinkle relaxer, is going to last typically 3 to 4 months. However, it really depends on how much you're doing. So I have patients all over the map on how much they do, your dose. So some people will do just a very light dose. I have people that are in acting and they tell me, I don't want all my frown lines gone. I still need to be able to show these lines and work. And so they're doing a lighter dose. I might see them more frequently. I have other patients that are I can only come in here twice a year. It's okay if I look a little bit more restricted or frozen. I just want it to last. Some people will last 6 months. But in general, most people, it lasts 3 to 4 months, and they're gonna come a few times a year to maintain that.
How long does your filler last?
And your filler is gonna last, depends on what areas we're treating, and then your metabolism, and then what product we're using. However, in general, most patients, the filler is gonna last about 1 to 2 years. Even with that, at the 1 to 2 year mark, the filler is not completely gone, but majority of it, the patient will notice has metabolized or is broken down, and then that's where they'll start noticing, hey, my lines don't look as soft as they used to look, or, you know, my under eyes look a little bit more sunken than than I was used to the past couple of years.
There's a lot of information on the internet right now about side effects of filler, side effects of Botox. Can you speak a little bit into that?
So biggest things side effect wise that you're going to experience are bruising and swelling. That is going to just come with the territory. You're going to have a needle poked on you, you could potentially bruise. Just like if you get your blood drawn, sometimes you bruise, sometimes you don't. There's things that you can do to prep before and then follow your post-care instructions to help minimize that bruising and swelling. Safety risks that we want to be mindful of when it comes to filler is that we're not blocking off blood flow. We have blood vessels all over our face, all over our body. We want to make sure we're not putting this gel to block off a blood vessel from the blood moving. So what we're looking for when we're doing your filler anywhere in the face is, or anywhere in the body, is that the skin color is normal, you don't have any extreme pain, you don't have any vision issues. Any of those things, if you had those signs, it could mean somehow we're blocking blood from moving like its normal pathway. What you do in that instance is dissolve the filler. I've never had to do this for anyone since I've been practicing since 2013, so it's extremely rare, but these are the rare risks that we want to be mindful of when it comes to filler. We want to tell you what to look for and what I'm looking for when we're doing this, and then just make sure we can intervene if we need to.
What if you don't want to get Botox or filler? What are some other options you offer?
So if you don't want Botox and filler, there are so many other things that you can do to help maintain the health of your skin, your hair. Our team can work with you, can develop a treatment plan to help with what you're doing at home. So we can give you recommendations on skincare and then treatments in the office. So in the office, we have hydrofacial, we have custom classic facials, skin pin microneedling, our laser, and then we have an all-natural filler alternative, PRF, easy gel injections. So that's made completely from your own blood. We'll draw your blood, we take out the growth factors, the stem cells, we're able to inject that in the face, again, made entirely from you, to make new collagen in the skin. Collagen is the building blocks of our skin. So there's so many things you can do. It doesn't have to be cosmetic injectables, just again, to maintain that glow and the health of your skin. Thanks so much for joining. If you have any other questions, drop them below. I want to make sure that we're getting your questions answered. If you want to schedule a consult with myself or my team, call or text us right here. Like and subscribe, and when you're ready for yours, come see us.